Hello, and welcome to the Conference on Asian Pacific American Leadership's Washington Leadership Program. My name is Denise Liu, and I serve on CAPAL's Board of Directors. We are a nonprofit organization that cultivates Asian American, Native Hawaiian, and Pacific Islander, or AANHPI, public service leaders by providing formative professional experience and growth opportunities through our annual public service, scholarship and internship program, our roundtable series, our mentorship program, and a series of sessions such as tonight's Washington Leadership Program, or WLP. WLP is one of our signature free programs that introduces students to AANHPI leaders in public service who can inform and inspire students' own civic engagement. For the first time in CAPAL history, this year's WLP series planning was led by a group of our recent scholar and intern alumni. As a reminder, all WLP sessions are recorded and live streamed on our Facebook page and will be available for later viewing afterward, including the materials. We'll proceed with today's session entitled Public Health and COVID-19, Our Stories. This session will discuss the current state of public health with a focus on the effects of COVID-19 within the AANHPI community. Topics of discussion include disparities in access to healthcare, variety of experiences and responses from the AANHPI community with the ongoing COVID-19 pandemic, and AANHPI data disaggregation in regards to public health. Panelists will respond to audience Q&A at the end. Follow and join our conversation tonight on social media using the hashtag #WeAreCapal. Thank you to our speakers and panelists this evening for spending their time with us, and to all of you for joining us. And a very special thank you to our 2022 sponsors for making programs like tonight's possible at CAPAL. Now, please give a warm welcome to Dr. Irwin Tan, Director of Thought Leadership Health at AARP, who will be our moderator for this panel. Dr. Tan will be leading the discussion and the Q&A. Dr. Tan, over to you.
Denise, thank you very much for inviting me. This is really an honor to be here today. My own background is I'm a physician trained in internal medicine and geriatric medicine. And as Denise mentioned, I work for AARP. My current work actually is really focused on the issue of healthy longevity. So when the years of good health expand to meet a lengthening life expectancy. And this is really critical given what's happened with disparities in life expectancy and health during the COVID pandemic. So I'm actually going to let the panels introduce themselves, and I'm going to go from my own Zoom screen, as starting with Lifa. Would you like to go first?
My name is Lifa Tamubel. I am the executive director of a nonprofit organization that work with Pacific Islanders in the San Francisco Bay Area. I am the executive director of Taulama for Tongans. And I'm quite honored and very happy to be joining you all.
Well, thank you very much. And then who else is up? So Jackie, are you our next panelist? Would you like to introduce yourself?
Yes, thank you, Dr. Tan. Hi, everybody. My name is Jackie Leung, she, they pronouns. Executive Director of the Micronesian Islander community. We're a nonprofit based in Oregon, providing services for our Micronesians in Oregon and back home on our islands. And in a separate hat, I'm also assistant professor in public health at Linfield University at McMinnville, Oregon.
And for everyone, please call me Irwin. I think we all want to be, we're all here at the table together, and I want to just make sure to elevate and honor everyone's experiences. I'm trying to see who else is. Vincent, are you able to join us? Would you like to be our next, introduce yourself? And you're on mute still.
There we go. How's that?
Good.
Awesome. Hang on. Start video. Hi. Sorry about that. Can you see me?
Yes, perfect. Thank you.
Sorry, guys, just got out of work. I'm Vincent Tam. I'm at the New York City Department of Health. We're multiple hats, but concerned with our conversation, we're talking about COVID. So I'm involved in the New York City COVID vaccination program. So I've worked through a number of positions within our COVID program since 2020, working currently as a site lead and also working with the citywide immunization registry that records immunization records. That's really important currently in this state of affairs.
Thank you. Thank you for joining us. And then Barbara and then Vivian, would you like to go next?
Sure, that sounds great. Thank you, Erwin. My name is Barbara Wei, and I guess the first thing is that I'm a Capal alum, so I was just like all of you who are listening here today as an intern. So it's great to be back. I am a recent grad of the Harvard School of Public Health. I did my MPH there, and I'm the founder of IME, which is an after-school program for Asian American teenagers supporting their social, emotional, and mental wellness. And I'll hand it to Vivian.
Hi there, everybody. My name is Vivian Huang. Thank you for giving me this opportunity to be on this panel today. So like Dr. Erwin Tan, I'm also trained as a physician. I'm a board certified physician in internal medicine and preventive medicine and public health. And during the beginning of COVID, I was with the New York City Health Department serving on COVID response. I helped to lead some of the early COVID clinics in the Lower East Side Manhattan area, in Chinatown in New York City. I've also had some global health experiences, trained in epidemics and outbreaks, have worked with Doctors Without Borders in Swaziland and also in Syria, and also in the 2015 Ebola outbreak in Sierra Leone. Currently, I'm transitioning into a new position. I will be the incoming Assistant Medical Director for Disease Control for Maricopa County Department of Public Health, and I'm based in Phoenix, Arizona. So really glad to meet all of you, and hope this will be a very exciting and interactive session. Thank you.
So Vivian, actually, since you're on, how about I just want to do a round robin and really have people sort of describe their own experiences during the COVID pandemic, and particularly as it relates to Asian American, Native Hawaiian, and Pacific Islander communities?
Yeah, that's a pretty loaded question, Dr. Erwin Tan. I think as someone—
And please call me Erwin. Please call me Erwin.
All right, I'll call you by Erwin, and please also call me Vivian. You know, I think personal and professional experiences have been really challenging. I think one of the main things that strikes me from this pandemic is how incredibly unprepared we've been in this country, and certainly got to see some of the iniquities play out in New York City, certainly for the Asian Pacific Islander population there. I think I'll leave it at that for right now. And then as we go through the session, we can certainly get more into the granular details of how challenging this pandemic has been, not only personally, but also professionally, not only just for the general population, but also down to our community level and down to our family level, family and friends. So thank you for that question.
Who would like to answer next? What were the experiences that you had during the pandemic, especially as it relates to the communities that you serve?
I'll take it.
Yeah. Oh, sorry.
Hi, I'll take it next. So my experiences were that that it was very humbling, actually. In fact, I believe, because I was freshly out of mailman School of Public Health at Columbia with a degree in toxicology, and we're dealing with this virus that we really had very little knowledge about, and how to treat it, what the vaccines were, and this global shutdown, the local reactions, and how people were coping with it mentally, physically, economically. There was just so much unknown, and there was quite a lot of fear involved. And as a public health official, one of the things that was really vital was to reach out to people, calm their fears, and try to explain to them the best, the best plans that we have available. And oftentimes it came down to me saying, I don't know. And that was actually very reassuring to many people, that we were being honest as much as possible with them, that we really don't know what's going to happen 5 years, 10 years down the line, but we know what's going to what we can do for the next 2-3 months, and hopefully next couple of years. So for me, it was humbling, eye-opening, and also a lot of experience, just building up that knowledge base to help the people and translating all the bit of scientific evidence and paperwork out there into bits that, people who without a science background can understand.
And Leifa, would you be next? And am I pronouncing your name right? I apologize.
Yes, that's fine. That's right. My experience was there was a lot of fear. There was a lot of ignorance about what it is. And so that's how we started. And it was very, very difficult to convince people to be vaccinated, Pacific Islander people, because you could tell them 100 things that were correct about COVID-19, and someone will come along with just one thing that went with their belief, that made them more comfortable, and they don't get the shots because it's not true. The same things that we all hear about through media. And so out of all that, they will choose to hold on that it's not true, that it's going to go away, and don't believe in, and the government wants to do this, the government, you should hear the stories that the government, they're going to be turned into monkeys. The government is going to put little magnets in them, and so they can trace them for wherever you are. You will not be able to hide from the government. And so apart from trying to get people vaccinated, it was also trying to dispel them of their fears and try and prove to them that this is not so. And part of that was the staff that we had. It was important for us to get vaccinated first and to put it out on Facebook so that they can see that you are actually getting the shot yourself. But it had to do with us not validating that fear is real, and the choice is theirs. So you had to try and educate them. You had to try and make them comfortable, but you also had to tell them that it is their choice and what can come, because if they choose not to be vaccinated, it will not just affect them, it will affect the whole family. And if you have elderly folks with you, they are the most vulnerable ones. And so it goes on, and it takes a lot out of you, because you sound like a broken record, and this goes on and on and on. But where do you take this? So the best way was for us to go through the churches, because those are the bodies that they have faith in. And so we went through the churches. Some of the churches were not agreeing with us, and they kept on saying, no, we'll just pray and we will get over this. And so there were so many things, and it was amongst Pacific Islanders. And then, of course, then there is the negative effects of the vaccination. Now and then somebody will report that they got really sick, and that alone was more powerful than all the education and the outreach that we did. So we went through that, that was the journey. And sometimes you felt really tired and depressed because you're knocking your head against the same thing over and over and over again. But the other part, I think, that saved us was the feeling that these people really need that help, and sympathizing with them and agreeing with them that we all fear this, because this is a strange disease, and all we know is that it kills. And so we hear the stories of when the islands had the Spanish flu or whatever it was that killed a whole lot of them. And then it was the measles. So those stories get rehashed and repeated. And these are just some of the things that we went through. And so up to now, there's still the part of the population that still refuse to get vaccinated. And they're the ones that were vaccinated, and they're proud that they have COVID again, and yet it's not as bad as it was the first time, that they can move around, they can walk because they had the vaccinations. So that's the journey. And that's one of the reasons why I wanted I agreed to be part of this panel, because this is so important to my population.
Thank you. Jackie, would you like to be next?
Yes. So Leofa, you've pretty much hit the nail on the head on quite a few things that happened specifically as well within the Micronesian community. To highlight some additional pieces, misinformation was a big one, especially people who were active on social media. They'd see a meme, or they would see a video and automatically share it. Other friends would look at it, start liking it, start commenting on it. And then we'd see a whirlwind of folks saying, oh, this is why I'm not going to get the vaccine because of X, Y, or Z. And one of the things that my organization, along with others, had pushed specifically in Oregon was when they started doing vaccines, they decided that they were going to start with the elderly communities. And within the Micronesian community, in terms of elder, it's not necessarily somebody who's over the age of 60, over the age of 70. Elders in our community could be in their 40s, could be in their 50s. It's not the age that makes somebody an elder. It's who they are within the community, whether they are on a clan, for example, or they're the head of their household. That makes them an elder specifically within those areas. And that was a challenge to be able to advocate for members of our community and making sure that the state, as well as the counties who were rationing the vaccines, to know, like, we need to make sure that we have people, not necessarily based on their age, but based on people on what we consider in our community to be an elder. And we were able to host a series of vaccine clinics that were specifically for Micronesian and Pacific Islanders. And we had staff, we had people who were there, even our staff and volunteers who were getting the vaccine the same day, so that they could see, like, and we were broadcasting it on social media so people know that we're there doing it live. And to encourage people to attend, we tried to reduce the amount of barriers. So that included, for example, having food boxes for people to take with them, having hot foods, as well as gift cards for them just to come. And when people were worried about getting the vaccine, we made sure that the interpreters that were available were members that we knew specifically from our community who were interpreters. So they had the experience in interpreting and providing that extra support and resource that members of our community needed. We also, for those who needed it, like if someone said to us that, oh, I don't have transportation, we asked, would you be willing to either potentially come in a taxi, or if we did a picked you up, like sit in the back, wear a mask, and trying to do what we can to reduce the potential spread, and ensuring that whoever was driving also was vaccinated so that those individuals felt a little bit more comfortable and safe. So like those were some of the major steps that we took as a community-based organization to try to address some of the main issues that we saw in terms of resistance to the vaccine or barriers to getting the vaccine. And even the idea of the mask, like some people didn't even have access to masks. So in the very beginning, we were able to connect with a few community members who made masks. And so we were distributing masks, but then when we got additional funding, we were able to purchase the KN95s to be able to distribute to our community to try and address all the different barriers that people faced, while recognizing that we couldn't reach everybody, but for the ones that we could provide any kind of support and services to help reduce a lot of the stressors that they were experiencing.
And Barbara, you want to go next?
Yeah, thank you. So my experience in COVID is actually maybe similar to Vincent's. When the pandemic hit, I was just about to enter my Master's of Public Health program at Harvard. So it was kind of thinking, for me, it was public health before the pandemic. People were like, why are you going to study this? Or like, what is this? And then post-pandemic, I really felt it had a surge of importance, and it became no longer invisible, became this critical piece of society that made kind of my schooling really enjoyable. And then while the importance of public health has been elevated and while I was at school, I definitely felt that Asian American issues, like, were at some points elevated, some points invisible. So I work in Asian American social, emotional, and mental health and wellness. And when I speak with people inside the community of AANHPIs, it's always like, oh, that's so great that you're working on this. This is so helpful. But when, as an entrepreneur, if you're going outside and telling other people about it, often I hear, is that really a problem? Or I never knew about that. And so I definitely felt that invisibility during the pandemic as well.
So I think what we have is just a great sort of range of like from the city public health level to the how it affected individual communities. And I wanted to sort of take all of that to just acknowledge that, as we all know, the COVID-19 pandemic did not affect everyone equally. Certain individuals and communities were at higher risk of being infected, often because of social determinants of health, whether it's housing conditions or having to work in essential jobs or the barriers to the ability to protect oneself. And then there were these pre-existing medical conditions that also reflect, generations of access or lack thereof that put people at risk for serious illness, hospitalization, or death. And I really wanted to sort of draw upon, from the city experience and the public health experience, to the community level experience, sort of what were those characteristics for your communities, social determinants or pre-existing diseases that really put your communities at risk? Who wants to go next? Oh, Vincent,
you're on mute.
So here in New York City, it's a city of 8 million people, and we have a lot of people that come in to commute into New York City to work on a daily basis, and we have tourists and travelers from all over. Many of the jobs that we have, such as owning deli stores, driving taxis, push cart vendors, restaurant workers, are minorities who are of AAPI community, and it was very difficult for them to oftentimes get their vaccines. Part of it was because of their work schedule. Some of them are, they run their own business, so just getting out to get a vaccine and then recover from it was difficult enough. And they're not always in the greatest shape either, due to the fact that they don't eat well or have much time to exercise due to the constraints of the job, being a business owner themselves. So that was one of the largest causes of the individual health. And then there are also, it's very, very common to see multi-generational households. And in New York City, our living spaces you're practically on top of each other, and you have multi-generational households living within large buildings, and the ventilation systems might be connected without any filtration. So it just compounds it. And commuting, you're going to the subway and you're in close contact and oftentimes in close quarters at work with the public, whether you're working in delivery or, like I mentioned, the taxi driver or whatnot. So there's that environmental factor, as well as the personal habits being a variable.
Vincent, I really like that. Like, you really incorporate the social determinants of health in terms of what jobs that people in specific communities have access to, and the housing conditions that then promote both risk and, in terms of infection, and also, the inability to get proper care to treating those pre-existing conditions. I remember talking to someone in the Marshallese community from Arkansas early on in the epidemic, where there was a large large exposure through food processing plants. And, I think that, I would love to hear more about these occupational risks. Like there were some of us who were able to live, work in information jobs and work from home, but there were so many people who are in essential roles that actually put them at continuous risk. So wanted to get a sense from folks about these occupational risks.
I could go. So in the work that we were doing specifically in outreach, a large number of people who became sick with COVID, especially in the very beginning, worked in those kind of factories. Many of them worked in either a trash separation or recycle places. A few worked in canneries, and many more who worked in some sort of factory that involved being indoors and large groups. And initially, when they had contracted COVID, they were told by their bosses, oh, stay home for a day or two, but you need to come back and we're not going to hold your job for you. So there was a lot of stress as well as demand for them to return, even if they were sick and if they weren't feeling well. And even if they had produced a COVID positive test or even a doctor's note that said that they can't work, they were told, no, you can't, you have to come back in because we can't function without you. And many of those individuals who couldn't come back, they were eventually let go. Then many more were eventually fired, especially when or either fired or let go. I'm not sure exactly what happened to those individuals, but when the plant pretty much shut down because they were told that you can't have people working within these spaces. So a large number of people who overnight just became not only for the ones who were sick, but a larger number who were now unemployed. And this was problematic, especially in households where it could be multi-generational, like Vincent was saying, or it could even be multi-families. So it's like different families who all live together to be able to pay their rent, who now all of a sudden don't have a job either. And so they were unable to pay for their rent, pay for their utilities. And then their landlords start knocking on the door saying, you need to pay your rent. And, you know, there was all those extra stressors that came into play that not only affected them work-wise, but affected them health-wise, and how many of them had to make that difficult decision of, I can't work, I can't breathe, I can't walk. And then to know that they were at risk of losing their job added that extra stress that they didn't need to have when they were just trying to recover and just try to make it day by day.
Who wants to be next?
Perfect. Okay. I think I just want to relate to what Jackie was saying, because that is what happens also to our population. But I think the biggest risk is just being Tongan, because not only are we multi-generational as we live, because we cannot afford, and especially in the Bay Area, where everybody knows that the rent and the mortgage is just unbelievable. And so instead of just one family, it would be 2, 3, or 4 families all in one home. And then to top that all, I think that we from the Pacific are also very much aware of what our being Pacific Islanders dictate to us. When there is a funeral, it doesn't matter whether the COVID is roaring at your side, everybody has to go to pay their respect, because that is the most important thing that we do, is go and pay our respect at funerals. And so that was one of the toughest things, is to try and convince people that they do not have to show up to a funeral. If there is a celebration of any kind, people will show up. And you try and explain to them how important it is that they keep away from each other, that they wear their mask, that they get vaccinated. But this is what being Tongan is. You know, when there's a funeral, that is your priority, not COVID, not anything else. Your priority is to show up and pay your respect. And that is why it was more of a challenge, because in these homes you have elderly folks and you worry yourself sick because these people are so vulnerable. And yet you have the younger parts of the family going in and out wherever they may go. And it's selective when they want to listen and when they want to do what they feel like doing. And plus being a Pacific Islander, it just compounds the whole situation. And this went on and on throughout COVID. But I think one of the things that I wanted to mention here is, I don't think that the organizations here that are supposed to help us fully understand the dynamics of the Pacific Islanders. And so in order for them to be able to help us, they should understand that this is who we are and this is what we do. But you cannot give us we refer to as the white man's way of doing things. I should maybe just say the non-Tongan way of doing things, because we don't relate to that. And we don't understand why you keep on telling for us to do these things when we don't want to do these things, or we don't believe in doing those things. And so I think that is something that is serious in my thinking and in my experience, that the organizations, the counties, the big organizations need to be educated in who and what we are. We're very small populations, but we have very complex issues. And if the desire to help us is serious, that those need to be addressed.
And at this point, I also want to let all of the panelists ask questions and interact. You don't need me to prompt these questions. I mean, I think what you just described is so critical, right? That they are both these occupational risks, but also these cultural factors that are both sometimes put you at risk or also provide protection or resilience, right? But I think it's the understanding of those specifics of a community in a situation where, you know, Asian Americans, Native Hawaiians, and Pacific Islanders often get aggregated, that make it hard for us to provide the specific care and interventions that each community needs. Vivian, I think you just went off mute. Would you like to go next?
Yeah, sure. So I've appreciated all these different experiences that have been happening, whether from a cultural level or whether it's from a social determinants of health capacity. I'll share my experience on the Department of Health side, and so that's where Vincent and I actually met. But when COVID, hit New York City, I was really compelled to go home. I'm from New York City, and so checked in with a couple of my physician friends and medical epidemiologists to see if there were needs at home, and certainly there were. So I came back to the New York City Health Department to work on COVID response. And I think that, on the flip side of the coin is that, yes, I think that it is important that communities that are different than the white community have certain ways of approaching them. I think that what I want to share is that it did fall short on the other side of the spectrum. So being someone that was working for local government, being in the health department, I was on the contact tracing team. So first I was actually stationed at Javits Center. When that actually mothballed, I was tasked to do contact tracing. And so one of the things I want to explain here is that we've never really done this kind of level of contact tracing for a respiratory illness, right? If you think about flu, for example, right? We don't do contact tracing for flu. If someone in an office gets flu or cold, we don't go around asking, who were you exposed to? Did you do this to isolate? But so here in the first time of history, if you will, the last great pandemic was in 1918. So it's 100 years after the fact, right? We certainly can do contact tracing for STIs. We can do contact tracing for HIV, even something like tuberculosis we do that for. But for the first time, since public health has been really stood up, is that we're doing respiratory illness. We're tracing a respiratory illness. And what I'll say is that on the side that I got to experience is, for example, I remember calling a bakery in Brooklyn, in the Chinatown area in Brooklyn, and needing to actually find out if the person had COVID, was actually exposing other persons in the bakery. And the reason why I was tasked to actually make that call is because they wanted someone that could speak Chinese. And I think that the health department has fallen short too often, is my feeling, is my experience, is that, that language capacity wasn't provided. And so they relied on doctors or, Vincent, right? Vincent, when we were working in the vaccine clinics, basically relying on staff that had this capability to be able to speak to the population they're serving. Now, mind you, they didn't pay me extra for this particular skill I had. And I've always advocated at the health department that if you have a language skill, it's not just because you're born into this and you're bicultural or what have you, but you need to be compensated for that. But anyways, to make a long story short, is that, you know, even with the competency of the language, I still, you know, met situation at the bakery where people would hang up the phone on me. And then once they saw the phone number, they wouldn't want to pick up the phone anymore to answer any more questions because they were worried about the health department possibly shutting them down, or it would get out into the news. And so, you know, I think it just exemplifies how there's such a distrust there of the health department, even though we're trying to do the right thing. But on the other hand, it's very complicated because it's someone's livelihood. It's the economics of the bakery, right? Not only are you providing these goods for the population that you're serving, right? I mean, I certainly love eating Chinese bakeries. I grew up, you know, I love, you know, pastries that, you know, my parents, you know, provided for me when I was a child. And so I was really torn because on the one hand, I really wanted to help my community. It's a, you know, it's a bakery that I love and I wanted them to stay open. And on the other hand, I was faced with the fact that being a physician, being a medical epidemiologist, I had to make sure that the persons were properly isolated so that it wouldn't further spread in the bakery. And so I just want to share that example because I know that on the one hand, you know, the populations that have been affected really did suffer inequities. I just wanted to share this example to show that on the other side of it, there's all these other complexities as to how do we meet people where they are, especially if you're a local government agency. So thanks for giving me that opportunity to share that.
And, you know, I think this really, the story about the funeral and the bakery, there's an interconnection there, right? They represent cultural, you know, community institutions that actually also provide strength. They provide opportunities to grieve together, opportunities to connect together, and they also offer vulnerabilities as well. And from the audience, Darian asked in terms of learning about other cultures, what are the differences between cultural competency and cultural humility? So that's a question I just threw out there from the audience. But if someone has another answer or another response and wants to take the conversation elsewhere, please feel free to go ahead. So who's next?
I can take this. So I think in that first part, in just about learning about other cultures as a public health professional, I think the very first thing is to listen and listen and listen and not come with your own agenda. So it's not coming to say, I'm here to make sure you don't meet in groups, right? But coming in and just saying, what do you need? What do you need to feel safe, to feel good, to feel like you're comfortable, and taking that as the first step. And eventually you can work in how to make sure you social distance or get vaccinated, but starting with listening, because the mindset you're coming in with might be different than what the community needs. And that is a very good, I think, first place to start when trying to learn about other cultures. And I'll let someone else talk about the differences between competency and humility. But I did want to get that out there, that listening is so important.
I'll back up on the listening part there because when we first started our vaccination program, we had no idea what to expect. We thought we had all the answers, but we actually didn't. And a really important part is listening to people's fears as to why they don't want to get vaccinated, why is there hesitancy, or you know, why they feel that what they read on WeChat or on Facebook is not going to happen or is going to happen. And part of listening also involves hearing what the different cultures need or want. For example, I'm Chinese American background, born here in New York City. Now, if a person, you know, who was born in China, they would look at me and call me an American, whereas an American person would think me more Chinese than American. So it's great. I'm straddling two cultures. However, there's a lot of Asian. The Asian culture is not monolithic. It's an aggregation of many cultures. All right, we have Far East, we have Middle East, we have Southeast Asians as well. And one of the things that happened was that during the winter, we had a lot of things going on. we had a lot of things that were going on. One of the things that went on was Chinese New Year, where Lunar New Year, where people did not want to get vaccinated, and also Ramadan as well. So humility was to learn about what aspects of the cultures they need, and competency was learning how to work with it.
Oh, okay, I guess my turn. Cultural humility and cultural competency, that is something that I have learned coming to this country, and it is thrown around a lot. But what does it mean to me? And we are a people that operate from our hearts, not from our heads. And that has always been us. And we are able to accomplish a great many things because of that kind of thinking and that kind of attitude. And so what does it mean for us when we're talking about cultural humility and cultural competency? I believe that the competency part is what we were taught on what is right and what is proper and what we should exercise as we go through life. But I think the humility is being able to understand what the culture is about. And I think that is something that needs to be either taught or be talked about amongst non-anybody, non-Tongans, non-Fijians, non-Samoans, because it plays a lot in our existence and the way we will move forward or the way we operate. And sometimes the way we feel is that maybe it's somebody, I retired from the county, and they would tell us something to do, or there would be directions and instructions on how to do things. And I'm thinking, if you could only come and learn from me how to help me, that would be so helpful. Because it's not you, it's not about you, this is about me. And you need to get in my head and in my heart and understand how I feel about things, because I believe that will be the way for you to help me. You know, don't come in and say, this we've learned, we did this study, and this is how we are going to do it. Okay, that may be well for whoever you studied, but that does not apply to us. And so I have found, I have been in this country for 50 plus years, and I still see that, I still come across that over and over and over again. And I'm just wondering, I wonder how difficult it is for people to understand that in order for help us, they need to really understand, get into our heads and really understand us. And then on the other side, I think, okay, maybe that's not fair. Maybe we should try also. So I think it should be movements from both sides, so that down the line there is real understanding of the issues and why we don't do things, why we keep on going to funerals when we're not supposed to go to funerals. And I think that would really help. But sometimes I wonder, I wonder to myself, how long will it take before you can understand us?
I think, this really speaks to also the richness of your own personal experiences of being members of your community and understanding your communities and that important role that you play. Vivian, you also mentioned in your first comments about your own personal experiences, right? And I was wondering if you wanted to share some of that as the next question, and would invite the rest of the panelists to add in on that as well.
Yeah, so I think this pandemic has not only touched us professionally, but also personally. And from the personal perspective, my mom is an older person. And so my mother is 72 this year. And, she doesn't really use the computer. She still reads newspapers, does watch TV. It's been in this country for quite some time, but, I think as an older person doesn't really navigate as well. The computer, she's just now starting to learn how to text with me, which is, kind of nuts if you ask me, but I'm glad she's doing it. At least she's, making progress. And you know, my mother always taught me that you can't move a mountain in a day, you chip away at it. And so when I was little, I would hear these stories that she taught me, a lot of Chinese, you know, stories, just so that, you know, when I'm an adult, that I would remember, you know, patience and tenacity and persistence. And one of the things that was really heartbreaking for me is that when the vaccines became available, my mother had a very difficult time in actually getting an appointment. And because my mom doesn't live in New York City, my mom lives in Maryland, and how they actually, you know, pushed out vaccines, you know, for those groups that were older, they did it mainly through online. And, you know, here's my mom, who's been in the country for 4 decades or more, you know, raised me here, I was born here, raised here, asking me, can you go on the computer and help me get a slot? And so that became really challenging. And I think that there are plenty of other folks that were in this situation. So not only are we talking about elderly folks having, you know, a challenge with navigating computers, but on top of that, you know, if there was a language barrier, right? So many of these kinds of online appointments weren't written in other languages when we started to roll out vaccines. And so that was kind of my personal experience. And my mother's calling me, asking me, can you help me get vaccine? And then, you know, our family pulled together, and we ultimately did get her her vaccine, and she actually had to call in, and they figured out a phone number. But I saw the same thing happen in the vaccine clinic with Vincent, you know, in the Lower East Side in Manhattan. There just was not that option for you to sign up by phone. And so you would see people coming to the school and waiting there. And, you know, it just felt like the system was so completely disorganized. And, you know, I remember too, initially when they opened up the lotteries for vaccine appointments, you know, more affluent or privileged persons, higher socioeconomic status, whether white or not, would end up getting those slots, and they wouldn't actually be coming into the district that it was offered for. And so here they uprooted the people that actually needed it in the communities. So you saw that inequity play out not only in New York City, but all over. And so I think, you know, I really like what Barbara said, you know, listening is really important. And I think that we made some missteps at the beginning. We just thought, hey, here, everybody's using the internet, everybody's on the computer, let's just roll this out. And meanwhile, we kind of forgot all of the older persons in our population that just don't navigate it as well. So we completely forgot about them. I think we've done better now. I think we certainly have learned some lessons. So I think that was one of the examples I wanted to share, not only personally with my own mother, but how it also translates into how we serve our population too, when we rolled out the vaccines. So thank you, Erwin, for kicking that over to me.
You know, and another related question from the audience, if folks want to respond to that, is, you know, what are you also personally proud of as part of your experiences for your communities during the pandemic? I was wondering who would like to answer next? Leofa, would you like to answer next?
I'm so proud when you feel that you have their trust and that they will come and get vaccinated because you're asking them. And I think that is why I do this thing and why I work with the community, because it helps me, because I'm a face that's familiar to them. We also have a radio program that's done weekly, and this is something that we address, whether it's COVID-19 or hepatitis or cancer, whatever it is. But I think that putting your face out there, going to their functions, just getting close to them, so that you can develop this trust, and they'll look at you and say, okay, she got the injection, so we can go. After we had put out on Facebook that I was getting vaccinated, there were so many phone calls of elderly folks who said, okay, we saw you got it, so we are going to get it too. So that really helps. But, you know, it's a small community, but it's so important to get their trust And I think what's important also is that they understand that you are walking with them. You're not there because you're the expert or you know more than they do, but you're Tongan and you want to help them and you can hold their hands and walk.
And Jackie, would you like to follow up next?
Yep. Leofa, again, really does the narrative the best in terms of how it was like to be able to engage with members of our community. Because even before COVID, we were already, MIC, Micronesian Islander community, was already out there trying to work on chronic diseases, specifically on diabetes prevention. Tuberculosis was an issue already, and now again, because of COVID, it's skyrocketed, rates have skyrocketed again once more in Oregon, specifically among Micronesians within the Chukis and the Marshallese populations. And one of the big things that we had specifically advocated for during this pandemic and even before was when it comes to translations, please don't outsource it to some random organization. Have people from our community who we trust, who have done translations, who or have translated for us before, be the ones to translate. Some of the earlier translations, specifically for the Chukis community and even for the Palauan community, in-house through MIC, we do have some staff who have done translations, and they've then the state, for example, or the county asked us to share resources. I took a look at it, and I may not be fluent in any of those, but then I sent it to my staff who were. They took one look and they were like, I don't know what they were trying to convey with this, but this makes no sense whatsoever. And many times we believe those translations were done by somebody who might have had an elementary understanding of the language or learned it as a second language. And we've told the state this. Some of them they ended up taking back and asking us to do some of those translations. So some of the victories, mini victories, I guess, would be we were able to get one contract specifically to do the translations for this one area about healthcare coverage. And while we weren't able to get all the continuation of all the different types of translations that are required, we are aware, and we do, when it comes to our attention, we take a look at it and we send it back to whoever the entity that wanted the translation done and explain to them, we don't know who you translated with, but this is incorrect. And we've gotten even better at advocating for ourselves when they've asked us, well, can you give us examples of what was done wrong, or can you do this for free? Like, no, we can't do this for free. You're asking us to take a translation, retranslate it, and tell you what's wrong with it. You need to pay us for our time. This is not something we can do for free because we don't have that kind of capacity.
That is so true, Jackie. Thank you so much. Barbara, I would like you to be next, and then Vivian, if you wanted to respond to the other question about American, Native Hawaiian, Pacific Islander representation, and then Letha, do you want to be next after that, after Vivian? Okay, great.
Thank you, Erwin. So some success stories, I think, during COVID, something that I'm really proud of is that sort of created IME during that time to give Asian American teens a place to talk, to a place to feel confident, a place to feel belonging and joy. And I think that through some of our workshops, we were able to create those moments, right? An hour and a half where we're talking about all the strengths that these Asian American teens have. An hour and a half, we're talking about all of these things that may have been weighing on their minds in our workshops. And I think that's what I'm really proud of, is being able to create those moments that were very light and happy in a time that was very stressful for them. And everyone needs that kind of relief. So I found that very rewarding during the pandemic. And I'll hand it to Vivian.
She works from home and she's by herself.
Sorry, I was typing in the chat box. So thank you, Barbara. I think this pandemic has, there's been a lot of parts of it that hasn't been so great. And I think I really like this, what have been some positive experiences that, we've come away with from the pandemic. And I will have to agree with Leofa that, the trust building, when you can somehow create that bridge and that connection, it feels so good inside. I just remember in the vaccine clinic, there was an older Chinese woman who'd come, and she had breast cancer many years ago. And so she had a mastectomy and then also had lymph nodes taken out and had lymphedema. And so she said to us, she absolutely could not have an injection in her arm. And so here we are trying to figure out what to do as a team because we hadn't come across that issue yet. So, and it was the first time our clinic, our pod that we set up, the point of dispensing, that this issue came up. And so I quickly looked over some of the CDC documents and was able to find that you can actually give it in the thigh. And so we all came together, and we had a nurse who could also speak Mandarin. And it was great too. Just a lot of folks who came out to volunteer for this clinic knew how important it was to be able to speak the language that we knew that was needed, whether it was Mandarin, whether it was Fujianese, Cantonese. We had folks that could speak Taiwanese, and so I think it was just. I think it just really touched me when we all could just come together and really help this patient. And I don't know, but I don't think this work ever gets tiring for me, because afterwards, when she did get the injection, we all worked together to make sure that she would come back, 4 weeks later to get the second injection. And we were all, trying to, explain it to her in the language that she understood. And, we all coordinated to make sure that she could come back. And, I'll never forget, because she was so grateful. She was just so grateful and just was like, thank you so much. Thank you so much. And that in itself is just, I can't explain it. I mean, even to this day, it's so touching, and it holds a very special place in my heart. So I wanted to share that positive experience, that of all the things that we've encountered through this pandemic, if you can reach one person, if you can uplift one person, that's the silver lining in all of this. And then I'll just pivot and transition and just say that the future of public health is promising if I think we can try to change the way we do things. I think that what we've been doing now hasn't been working, and we've got to figure out other ways to do public health. And I will just say that right now we're dealing with monkeypox. And so monkeypox now has already become a huge issue. And luckily we have a vaccine available, but it's going to be a broader issue. And I would say that for, someone asked, is representation enough in public health? And I don't know that that is enough, because when you look at the medical field, we are overrepresented. The Asian Pacific Islander community, we make up more of the medical public health community than we do actually in the general population. But why are things so that I don't know that I've seen progress, I think, since my 20s. So, now I'm in my 40s. So in the last 2 decades, I've seen progress made. But I remember when I was 15 years ago, sitting in CDC lectures or sitting at the health department, I would never see Asian data, right? It's like, why am I sitting here looking at this data? And it's like, I'm sitting here and you've got no data on me. So I'm representation of my community, of what I come from. And so nowadays, when I sit in a meeting and if I see that there's no Indigenous Native American data, or if there's no Asian Pacific Islander data, I ask, I say, where is that data? Because invisibility is also another form of discrimination. I think my mother taught me when I was younger to not, rock the boat and to not speak up. But the thing is that I think that's done a disservice for us, right? Because we're a collective, and that we want to do things for our community, but we sometimes are seen as maybe more timid, right? Or the meek, right? Because we don't speak up, because we're trained in this Western world that if you speak up and if you are able to promote yourself more, then that means that you're competent, or that whatever. But I don't know that that's worked. And so I think for me, I try my best to always say, I'm not invisible. Please provide data that shows the community I come from. And so I urge you all to also do that. Whenever you're in a room, ask, where is that data? Well, how come I'm not in that data? So yeah, I'll stop there and hand off to the next person.
I would just say that that's particularly important for Native Hawaiian Pacific Islanders, who are often aggregated with Asian Americans. which is not in accordance with the OMB guidance. So I think that data aggregation is very important. And Lealtha, next.
I think as far as our data, we have been able from the federal government to be separated from the Asians, so that we're part of Hawaiians and other Pacific Islanders. But at the same time, on the topic of translation, that was one of the most frustrating things that I encountered while working, because I don't understand why people would think that if you let someone translate using the internet, would give you the meaning that you're trying to get across to the people that you're doing this translation for. But I mean, it was so shocking because when I read it, it was in Tongan, but I couldn't understand what it was, because this was just taking, they Googled it and then used it for translation and paid for it. And then they would give it to me to review, and I would review the whole document. And I'm not paid for it because that's part of my job working for the county at the time. But I couldn't figure out why double the effort and the expense to do something that's not useful for anyone. And that tells me how much or how little these organizations think of us. You know, let's just do that and it's done without, and why waste all that money and time when nobody can understand what it is? The other thing, we talk about the stigmatized, that's part of being Tongan also, when you get stigmatized because of a disease. And it used to be TB. My mother died from TB, and that was the stigma almost my whole life, till I got to the point where I finally accepted it, that nothing is wrong. She was unlucky that she had TB, and at the time there was no cure for TB, and she died. But in my culture, it was stigmatized, and I think we're still carrying this burden with us for many years, and that's on us. But that does not mean that we could be educated and be enlightened. That diseases are diseases, and it's not your fault that you have it. You're just unlucky that you had it. But I just wanted to bring that up because for us, stigmatizing an illness is huge.
Yeah.
And
the stigmatization was actually very important for Asian Americans and Pacific Islanders, given the misassociation in terms of the origins of COVID. So that's very important.
Yeah. And so when I see what they did with COVID and I'm thinking, no wonder my people are scared of it, because they don't try and just simplify it and make us understand what it is, that it's something that happens, but it can be helped. You can be vaccinated. You can stop going to big functions. You can put your mask on. I mean, all these things. And so in my organization, one of the things that I really enjoyed was we did little postcards, and we put little faces, and it was like a two-word thing or 5-word thing, but it will send out the message, and sometimes it would look funny. So to encourage them that this is something that everybody needs to have done.
Yes. So Jackie, what are some examples of public health policies that the Asian American, Native Hawaiian, Pacific Islander communities can advocate for to improve access and education for all communities? And how can running for public office help, such as what, Jackie, that you're doing in the state of Oregon?
So to answer the first part, when it comes to data, I mean, we've been touching upon it, data disaggregation. We need to see that separation of data. I mean, when we are already lumping together the Asian American, Pacific Islander, and even the Native Hawaiian experiences, we are pretty much erasing the data that actually shows what the disparities are. We're missing out on like some of the different, the diverse different groups that even within the Asian American communities, as well as even what's happening within the Pacific Islander communities. I mean, we have the Native Hawaiians, we have Pacific Islanders, but even within the Pacific Islanders, we have Micronesians, and all those different experiences and their voices and their health experiences are lost. I mean, if we weren't combining all the data, it doesn't look the same as it until you separate it. And I saw someone had put in chat, for example, and this is something that's, if you look at the data, it shows specifically for Native Hawaiian, Pacific Islanders, but especially Micronesians, when it came to COVID, there was a high rate of number of individuals who died from COVID, who were severely ill from COVID, who still are now suffering from the long-term impacts of having long-term COVID. And in terms of the other part of the question, in terms of running for office, I mean, yes, we need more representation, but we also need representation on all sorts, all forms of leadership, whether it's elected, whether it's a city, whether it's a county, whether it's a state, at the federal, and even in nonprofits, as well as boards and commissions, because our stories, our experiences, our narratives are being erased. We are not able to share what's going on, what we are seeing, what we're experiencing, and that long-term impact, we're losing out on ways to ensure that our community is represented at all different facets. And that is what we need. We need to ensure that we have opportunities for leadership, ways to ensure that our youth, especially our youth, or even our elders, have a say, have an opportunity, that they know that if they had somebody that something that they want to say, who they can go to. And perhaps it would be them reaching out to a senator, perhaps it's them who's reaching out to a city councilor versus like, oh, I don't know what to do, or this is not my business. So instead of hiding or thinking that it's not something that they can get involved in, knowing that they can be involved, and here are ways to get involved.
Thank you. That's very powerful. You know, one of the terms of representation also is, and accessibility is that question of mental health access, and the perception of stigma, not only for COVID or other diseases, but stigma for seeking assistance with mental health. And can folks respond to that in terms of the Asian American, Native Hawaiian, Pacific Islander community, in terms of representation, in terms of the need for providers or access or stigma? Who would like to answer that question?
I think I can start. And Liafa, I can send it to you right after. So I think in the Asian American community, in the teens and the parents that I work with, I actually feel like there has been some improvement over COVID, and that when I interview and talk with a lot of the parents and the teens, mental health is a key priority. Mental health is like, you know, on the table for discussion. The parents are aware, the teens are aware, and they're really seeking out opportunities to practice it, right? And I feel like when I was growing up, that was not something that was kind of front and center all the time. So I think that has been a really great improvement. I think there have been things that happened with COVID that have made mental health even more challenging. So obviously the rise in Asian hate has been very, very difficult for a lot of these families. I spoke with one family who has a young daughter, I think she's like 9 or 10, and she said that they were in their neighborhood at a Starbucks and someone like took their coffee and like threw it at their car and said like, get out of my neighborhood. And they were in their own neighborhood, right? Like they lived there. And the mom was asking like, how do I explain this to my daughter who's 9, right? How do I explain some of these things that are happening to us and she as a parent felt like, I spent my whole life trying to fight that and now it's here again. And so it's kind of like layers of challenges for these families that have been very difficult. So although mental health is on the table, right? It's on the table for discussion, has been elevated. The communities are still facing a lot of challenges. And one thing that's been hard is that I feel like these communities are not used to accessing mental health services. So it's just a little bit lost in the beginning. Like, where do I go? Do I talk to my friends or do I go on WeChat, like go on the internet and start Googling? And that creates some misinformation opportunities that could happen. And I will pass to Liafa.
Okay, thank you. I worked at the county at the Behavioral Health and Recovery Services. And that was an eye-opening job for me. Because before I came there, I was scared out of my wits at any mention of mental illness, because that is my experience from my country. That it's stigmatized and you fear, because it was connected to the after world and it was connected to all kinds of voodoo kind of stuff. So it really scared me. When I first went for my interview, I couldn't sit there because there were clients who paced up and down, and they scared me. So I had to leave and wait outside for my interview. But I finally made it. And so I worked for 20 plus years before I retired. And one of the things that I have found was how much we needed mental health, mental wellness in my community as a people, because it's so stigmatized, it's never talked about, and yet you see it. You see it, it's growing because we cannot quite master the art of living in this country, because we're Tongans who are trying to be Americans and kind of failing both. But it's ongoing. And so in our relationship with the county, for example, we need this. We need someone to come in and talk to us about mental illness. We need to be helped with our mental well-being, because there's so much frictions. There's family, there's discontinued and all kinds of things wrong with families, which we don't do anything about. We try and just tough it out, but it is not helping us. And it doesn't help us to move forward because our mental wellness is not balanced. And there's nobody to come and help us with that. So what we do in the work that we do is try and have conversations, sitting down and sharing, not because we're experts in the field, but because we know a little bit more about how to try and bring out the issues and the things that make families break up and fight and everything, make churches break out. A part of the church will break out and go start another church, instead of trying to resolve our differences and to learn what was it that made this happen. We are very fast to just get up and leave and go start off somewhere else. So mental health is something that we as a people badly need. And I'm hoping that we will see this brought into the community, through outreach and education, where it's taught from a young age, where it's taught when we're even in the churches, even as a family. We need this. This is something that we really need.
Thank you. That's very important. I think it's the voice of within the community that's important to start breaking down the stigma for seeking help for mental health access. So I think that's important. Vivian, do you want to go next?
Yeah, sure. So I really appreciate the comments that have been made just now about mental health. I think it continues to be stigmatized. I speak from my own Chinese American community perspective in how, I think mental health is still, I think at this point, really much stigmatized. I started off in a psychiatry residency. I wanted to be a psychiatrist, and my parents said to me, why are you doing that? Why don't you think of some other specialty? And they weren't even aware that medical school does lead to a psychiatry specialty if you would like to take that route. And so my generation is I'm Generation X, and so in my 40s, and so within my own family we battle with talking about mental health, yet there are plenty of family members of mine that have either depression or postpartum depression when they had their children, anxiety, and yet we as a family continue to sweep it under the rug. And I think that the solutions may not be in the Western models that we've learned. I think the more that I was trained in the Western model, went to medical school here, did residency here, and I don't know that is actually the model for healing, right? It feels like this medical industrial complex. And what are we doing? It's, pharma would like you to be on a pill and that would fix all of your, feelings of despair or suicidal thoughts. And I just don't know that that's the way to go anymore. I've been practicing medicine for 15 years now, and it's been really challenging to see how I'm not sure that mental health and psychiatry have really done well, not only for the Asian American population, the Native Hawaiian Pacific Islanders. I don't know that model, you can't have a one size fits all model. I remember trying to take my mother to therapy, and she went because she loved me. She went with me, but the interaction was just completely bizarre because my mom didn't want to talk about herself, and she would ask the therapist all these questions. And when the spotlight came back to my mom couldn't. She just, she was raised in Taiwan. She came here, just had a different way of understanding mental health. And maybe there are different ways we approach mental health. Is it always that Western model where you go in front of a therapist or a psychiatrist, and then they offer you some pill? And it's and I won't even get into the pharmacogenomics of all this. Like, does this work in Asian populations? And so I think there's other ways that our government and our communities, maybe we can think about new ways of healing. How are we trying to heal our communities? And I don't know that I got taught any of that in medical school. Like when you come together as a community, when you garden together, or when you sit at a table and share food, and maybe those are the ways that we start to uncover what is actually happening with people. So I do think it's an issue that is persistent, certainly with a lot of the Asian violence that's happening, with all the women that that passed away in Georgia. Like I don't know, I feel like sometimes we've made progress. Yes, I think we've made progress since I was little, for sure. I definitely see people on TV now. I'm like, oh, that person, I like kind of look like them, or something. But when I was little, there was nobody. It was like Connie Chung was the only person, I think. And so we've definitely made progress, but how do we continue that progress? And how do we, pass the baton so that our future generations are in a better place than where we are now? So so those are my comments, and thank you for the previous comments too. I'll hand it off now.
Liafa, would you like to go next?
I'm sorry.
Did you unmuted? Did you want to say something?
No, I was listening.
So I'm going to take a moment of the moderator's prerogative to just really, first of all, thank everyone before I hand it off to Denise. I think that this has been a very rich conversation. I think that brings out both the population issues, but also the community-specific issues. And yet again, really emphasizes why we need to have better data and targeted interventions and good relationships within the Asian American community, and often with Native Hawaiians and Pacific Islanders, who are often inappropriately conflated with Asian Americans. I also really appreciate this last conversation about mental health, because I think it's something that, Vincent is back on it. So Vince, I'm gonna let you speak after I go, and then we're gonna turn over to Denise. I think that, I had the opportunity to take a fellowship in integrative medicine at the University of Arizona, and talking about, how culture is part of both, that culture can be part of the healing. And I think the University of Hawaii actually has a intervention based on hula to help people with treating their diabetes. And it's often the community aspect of bringing people together that often serves as that bond, as a positive, that positive feedback that allows people to adhere and sustain an intervention. And then, and I just wanted to also bring out the issue of grief, because as we talk about mental health access, grief is often the way in which we have cultural institutions like the funerals, right, that we talked about. And then if we expand from grief to all the other things that we've lost, not only loved ones, but ways of life, employment, communities, if we expand that from grief, it's often a way I feel that we can talk to people who may be resistant to seeking mental health services, to talk about all the other things they've lost and the needs that they have as well. So Vincent, I know that you had some computer problems. Did you want to add anything else? And then after that, I'm going to turn it over to Denise.
You're muted.
All right, that's why I've been having computer problems. I'm still learning. So in terms of mental health, I believe that we need more people who understand our culture. It's oftentimes that we experience therapists and other professionals who don't understand our culture. We simply cannot just move out of that house. I think many of us can attest to that. We need someone who shares our culture, our language, and even maybe our own ancestry to really understand why we have these, why we straddle two cultures, our parents' heritage as well as the American way of life, and trying to find ways to resolve it. And this is not just for the public, but this is also for health professionals out there. During the pandemic, many of our health professionals were suffering from trauma, from burnout, from all sorts of stressors. And we need to also find ways to specialize in looking at the mental health aspects of Asians and Pacific Islanders who work in public health and in the medical profession, and help them so that they can continue helping the public that we are targeting. And it kind of brings me hope that our future is going to be pretty bright, because this is a chance to reset. We're seeing, there's so much awareness now. The fact that we have a panel and that we're openly discussing all these ideas, all these critical theories, and actually criticizing a system that has in many ways failed us, that we could actually make a new normal, a better future. And it starts with the conversation, and starts with people like here who are asking the questions and listening to us yarn about our experiences, and apply it and take it and run with it. And the culture. So one of the most profound things I heard from an elderly gentleman who was a Chinese or Chinese descent was that it's great that you learn your language, that you could communicate with me, but the fact that you learn our culture, our language, is also to help protect the elders within our community. And I encourage you to continue doing that, because we need people like that. And he was a prime example of a lot of Asian Americans would come to our site because they knew that there were translators and people who understood them. They might come, there might be a site that's close to them, but they believe that they would get the best quality of care if they came to us to help them with their problems. And in terms of public health, we have to fix the inequities that are baked into the system. And to do so, we can't just focus on the medical aspect, but also look at the political, environmental, the social issues that are involved. But I'm pretty confident that we'll do well. Thank you.
That ending the note of hope, I think, is really helpful. Denise, I want to turn it over back to you, and to thank all our panelists for a really interesting conversation that really brought these issues from your direct experiences and from your heart to the audience in general. Thank you.
Yes, thank you so much, Erwin, and also for Liafa, Jackie, Vincent, Vivian, and our 2009 S&I alumna, Barbara, for your thoughtful conversation this evening. It's been very enlightening and insightful. And thank you to everyone for joining us tonight to provide your perspectives. As a healthcare executive for almost 40 years, this subject is very near and dear to my heart. We hope you have enjoyed our 4th WLP session of the summer, and we've got 2 more sessions for you. So our WLPs are held on Wednesdays from 6 to 7:30 p.m. Eastern via Zoom. Next week's WLP is on education equity, where do we stand? where we will discuss educational disparities within the AANHPI community, as well as the experience of AANHPIs within the education system. You can register on our website at capal.org and view all of our upcoming events. Also, follow us on social media to learn about our S&I and other programs at Capal DC. As an added note, Capal just started a process for accepting applications for new board members for the 2022 to 2025 term. If you're interested or have questions, information and the application are also available on our website at capal.org. We will be accepting applications through July 19th. So thank you again to our 2022 sponsors for your continued support for our programs and continuing to provide opportunities for our AANHPI students and professionals in public service. Thank you for attending our 4th WLP session of the summer, and hopefully we'll see you again next week. Good night, and for our panelists, please stay on for another minute so we can take a screenshot.